Thank you for viewing this educational presentation. This module discusses prostate problems, in particular, non-cancerous enlargement of the prostate called benign prostatic hyperplasia, or BPH. The prostate is a chestnut-sized gland situated at the bottom of the urinary bladder, the place where urine is stored. It surrounds a portion of the urethra, or the tube that carries urine from the bladder out through the penis. The prostate gland secretes a thin, milky fluid that nourishes and helps activate sperm cells. This slide shows how the prostate is associated with the male ejaculatory system. Sperm is made in the testicles and travels through the vas deferens to join the ejaculatory duct. Fluid from the seminal vesicles and prostate also passes into the ejaculatory ducts to bathe the sperm and create semen, which is expressed out through the urethra during orgasm or climax. As mentioned, the prostate produces a small amount of thin, milky fluid that nourishes and helps activate sperm. An important part of prostate fluid is a protein molecule called PSA, or prostate-specific antigen. This substance works to liquefy or break down semen fluid to free up sperm, allowing it to travel to the female egg for fertilization. Some PSA is also released into the bloodstream and can be measured there to indicate prostate activity. There are three main causes of so-called prostate problems. Benign or non-cancerous enlargement of the prostate, called BPH, is dealt with in this module. Inflammation of the prostate, or prostatitis, and prostate cancer are also common prostate conditions. These are discussed in separate presentations. As one of a man's sex glands, the prostate is affected by male sex hormones, which stimulate the activity of the prostate and the growth of prostate cells. The chief male hormone is testosterone, produced almost entirely by the testicles, with a small amount also produced by the adrenal glands, which sit just above the kidneys. Many other conditions of the bladder and urinary tract can cause symptoms which mimic prostate problems. This slide lists some of the most common ones. You can see by this list that your doctor has a number of possible conditions to keep in mind when evaluating your symptoms. So what is BPH? A man's prostate often enlarges or grows bigger as he ages. It is a very common condition. The enlargement occurs because of multiplication of cells in the prostate, which is called hyperplasia. The process is not cancerous and therefore referred to as benign. BPH is very common. The prostate begins to grow in many men during their 30s, with growth stabilizing in some but continuing in others. By age 60, more than half of all men will have an enlarged prostate, and 60% of men in their 60s will have it. By age 80, 90% or 9 in 10 men will have BPH. Interestingly, not all men with an enlarged prostate have symptoms. Only about 40% of those men in their 60s with an enlarged prostate are actually bothered by it. Testosterone is converted in the body to another hormone called dihydrotestosterone, or DHT, and it is this hormone that regulates the growth of prostate cells. The complex processes that ultimately lead to BPH are beyond the scope of this presentation. As the prostate enlarges, it compresses inwards into the urethra, obstructing the flow of urine out of the bladder. This obstruction occurs not only because of physical enlargement of the prostate, but also because of increased numbers of muscle fibers in the prostate and/or increased tone in these muscle fibers. These muscles have a gripping or squeezing effect around the urethra. Obstruction of urine flow causes symptoms of a reduced urinary stream, difficulty starting the stream, and poor bladder emptying. Also, as a result of obstruction to urine flow out of the bladder itself has to work extra hard to empty. With time, the bladder muscle can then become thickened and more sensitive, and the ability to hold large amounts of urine decreases. As a result, one might have to empty the bladder more frequently and might have stronger urges to urinate. Someone with BPH may feel the need to urinate frequently, or they may have sudden urges to urinate. Their sleep may be disrupted from having to wake at night to empty their bladder. They may strain to begin urinating or have difficulty completely emptying the bladder, and the stream may be weak or slow to start. There may be dribbling of urine afterwards. Together, these symptoms are referred to as lower urinary tract symptoms, or LUTS. When left untreated, BPH can lead to a total inability to urinate, called urinary retention, which requires insertion of a tube into the bladder, or catheterization. It can also result in blood in the urine, weakening of the bladder, bladder stones, urinary tract infection, or even kidney damage. Having said this, for most men, BPH is not life-threatening. It can, however, be embarrassing, inconvenient, and uncomfortable, and can significantly impact one's quality of life. Your doctor can use several methods to diagnose BPH. First, you will likely be asked about your medical history and may need to answer a short questionnaire on urinary symptoms. The doctor may perform a rectal examination, feeling the prostate gland with a finger. This is referred to as a DRE, or digital rectal examination. In this, the doctor will check the prostate's size and condition. Occasionally, an ultrasound may also be used to help estimate prostate size. You may require a blood test and a urine test, and you may be asked to urinate into a special toilet that measures urinary flow rate. Because prostate enlargement occurs naturally with age, there are no specific prevention guidelines. Some men simply appear to be programmed to experience more significant or bothersome enlargement. At present, there are no clear ways to naturally alter this programming and prevent or slow prostate growth. Treatment for BPH is usually recommended for the following reasons: bothersome symptoms which affect one's lifestyle, worsening symptoms where one is at risk of progressing to a more serious situation, and unwanted consequences of obstruction, including urinary retention, infection, kidney failure, bladder stones, and bleeding. Patients at risk of progressing to a more serious situation are those with a very large prostate size, an elevated PSA, severe symptoms, poor bladder emptying as evidenced by an increased residual urine volume, or a slow urinary stream. BPH can, however, be successfully treated when it does occur. Treatment options include lifestyle changes and regular monitoring of symptoms, supplements and phytotherapy, medications that relax the muscle within the prostate, called alpha blockers, medications that shrink the size of the prostate, called 5-alpha reductase inhibitors, medications to relax the bladder, called antimuscarinics, combination therapy, using different types of medications together, or surgical therapy. In general, treatment progresses from simple measures to more aggressive measures as the severity of the problem increases. All of these treatments are discussed in separate modules, and your doctor can direct you to the material most pertinent to your situation. There are many types of surgical options available, although not all centers and not all doctors will offer each one of these. This slide shows how the choice of surgical treatment progresses from minimally invasive to more aggressive as the prostate enlarges. Surgical options include microwave therapy, or TUMT, needle therapy, or TUNA, prostatic stents, laser vaporization, called PVP, transurethral incision, or TUIP, transurethral resection, also called TURP or TUPPER, laser prostatectomy, known as HOLEP, and open surgical prostatectomy. Let us now review some key points about BPH and its treatment. Treatment for BPH is usually recommended to relieve bothersome urinary symptoms. The choice of treatment, therefore, will depend on how severe your symptoms are and how much they bother you. Men with mild symptoms usually choose to simply make some lifestyle changes and monitor things closely. Those with more bothersome symptoms will usually begin with medical treatment, then progress to surgery if medication does not satisfactorily relieve them. Less commonly, men present with BPH and already have complications related to it, like complete inability to urinate, bleeding, infections, bladder stones, or kidney damage. For these patients, surgical management is usually recommended depending on the situation. There are many issues that you and your doctor may need to discuss in choosing the best treatment for your situation. These include the severity of your problem, the risk of progression of your condition, effectiveness of the treatment, how long the treatment effect will last, possible complications of treatment, you and your doctor's preference, and the cost of treatment. Urinary symptoms and BPH can also significantly impact on a man's sexual function, especially erectile function and ejaculation. Many studies have shown that the likelihood of urinary symptoms, BPH, and sexual dysfunction all increase with increasing age, and convincing evidence now exists to support a cause and effect relationship of BPH and sexual dysfunction. Finally, while the treatment of BPH most commonly has no impact on sexual function, it may in fact improve or worsen symptoms in different situations. Regardless of your situation, there are certain lifestyle changes you can make which may lessen the symptoms of BPH. It is thought that reducing caffeine and alcohol intake, smoking cessation, reducing fluid intake at bedtime, maintaining a healthy weight, and staying physically active can offer some relief to some people. Men with small prostates and mild, not too bothersome symptoms will often choose to avoid medications or surgery and go on a regular monitoring or watchful waiting program. This involves introducing lifestyle changes to help improve symptoms, then regular follow-up visits to reassess symptoms, the impact of those symptoms on lifestyle, and the size of the prostate. Depending on the situation, other testing may be done, such as a PSA test, a urine flow rate test, and measurement of residual urine volume after voiding. The big question, of course, for any man considering watchful waiting rather than medical or surgical treatment is, what are the chances that things will worsen over time? From several recent excellent studies, we can now draw the following conclusions. Overall, about 20% of men with BPH will have worsening of their symptoms over 5 years if no treatment is taken, and approximately 10 to 25% of patients with moderate to severe symptoms will go on to require surgery within 3 to 4 years or more. Benign prostatic hyperplasia, or BPH, is the most common cause of urinary symptoms related to the prostate. BPH is an extremely common condition, and the likelihood of developing it increases with age. There is no way to prevent BPH, however lifestyle changes can help to improve symptoms, and good treatments do exist. The goals of treatment begin with helping you to improve your quality of life and ultimately preventing the health consequences of BPH. The choice of treatment can depend on several aspects, including severity of symptoms and degree of bother, the presence of complications due to BPH, the risk of progression or development of complications, the preference either of the patient or physician, and the effectiveness and side effects of the treatment. This slide lists some of the many resources available where you can find more information about prostate problems and BPH. These current references were used to assist in the preparation of this module. All of these are available through your local medical library or the internet if you are interested in more detailed reading on this subject. Thank you again for viewing this presentation. Talk to your doctor if you would like to learn more about your condition.